Internal resorption definition. Resorption is defined as a condition associated with either a physiologic or a pathologic process resulting in loss of dentin, cementum or bone. So it is due to the physiologic or pathological process and loss of dentin, cementum or bone. So internal resorption is an idiopathic and slow or fast progressive resorptive process occurring in the dentin of the pulp chamber or in the root canal of the teeth. So it is idiopathic and slow or fast progressive resorptive process, and the dentin, it occurs in the dentin of the pulp chamber or in the root canal of the teeth. So this is internal resorption. So internal resorption is loss of dentin, cementum or bone, and it is idiopathic, slow or fast progressive resorptive process. Next, moving on to histopathology. Unlike caries, the internal resorption is the result of the osteoclastic activity. So it is due to the osteoclastic activity. Osteoclasts are bone resorbing cells, and the resorptive process is characterized by lacunae which may filled in by osteoid tissue. So the osteoid tissue may be regarded as an attempt at repair. So the presence of granulation tissue accounts for profuse bleeding when the pulp is removed. If we remove the pulp, there is profuse bleeding due to the granulation tissue. So the multinucleated giant cells or dentinoclast are present. So multinucleated giant cells and or dentinoclast are present. The pulp usually is chronically inflamed. So the metaplasia of the pulp, that is transformation to another type of tissue. So pulp is transformed into another type of tissue, that is such as bone or cementum. So this is the histopathological. So histopathologically, the surface of the pulp polyp is usually covered by stratified squamous epithelium. The pulp polyp of deciduous teeth are more likely to be covered with stratified squamous epithelium than those of the permanent teeth. So the granulation tissue is a young vascular connective tissue containing polymorphonuclear neutrophils, lymphocytes and plasma cells. So here next, moving on to cause. The internal resorption cause is not known, but such patients often have a history of trauma. So mostly patients have a history of trauma. Next, moving on to symptoms. So internal resorption in the root of the tooth is asymptomatic. That is asymptomatic. In crown of the teeth, internal resorption, if it occurs in the root of the tooth, that is asymptomatic. If it occurs in the crown of the tooth, there is a reddish area called pink spot. So the reddish area represents the granulation tissue showing through the resorbed area of the crown. Pink spot, it is very important. Internal resorption occur in the crown, that shows a pink spot, the reddish area. So it represents the granulation tissue showing through the resorbed area of the crown. This is the main symptom. So this picture showing the pink spot indicate of an internal resorptive defect seen in the palatal aspect of the crown of the maxillary central incisor, showing the pink spot. It is due to the internal resorption. Next, moving on to diagnosis. Internal resorption may affect either the crown or the root of the tooth, or it extends through the involve the both. So it either occur crown or root of the tooth or both. So it may be slow, progressive and intermittent process extending over 1 to 2 years, or it may rapidly and may perforate the tooth within a matter of months. So it is slow or fast. So although any tooth in the mouth can be involved, and most commonly occur the affected tooth is maxillary anterior teeth. So usually internal resorption is diagnosed during routine radiographic examination. So routine radiographic examination. So the appearance of the pink spot occurs late in the resorptive process. So when the integrity of the crown has been compromised. So this picture showing the radiographic image of the same tooth showing an internal resorptive defect with intact crown margins. So there is an intact crown margins, but center there is radiolucent area. This picture showing the extracted tooth showing evidence of internal resorption causing root perforation. So this is also case of internal resorption showing root perforation and showing the granulation tissue. Next, moving on to differential diagnosis. So when internal resorption progresses into the periodontal space or a perforation of the root occurs, it is difficult to differentiate from external resorption. So in internal resorption, the resorptive defect is more extensive in the pulpal wall than on the root surface. So this defect usually recognized by means of radiograph. So we have to take radiograph for differentiate from the external resorption. So in external resorption, in internal resorption, there is resorptive defect is more extensive in the pulpal wall than in the root surface. In external surface, it is more occur in the root surface. Next, moving on to treatment. The first best treatment is extirpation of the pulp. Stop the internal resorptive process. So the routine endodontic treatment is also indicated, but obturation of the defect requires a special effort, preferably with a plasticized gutta-percha method. So in many patients, however, the condition progresses unobserved because it is painless until the root is perforated. So such cases, we have to try mineral trioxide aggregate, that is MTA. So it's recommended to repair the defect. So when the repair has been completed, the canal is obturated with plasticized gutta-percha. So MTA is initially given, and next after the repair occur, we going for gutta-percha. So the prognosis is best before perforation of the root or crown occurs. So before the perforation of the root or crown occurs, the prognosis is good because root canal is done. It gives a better prognosis. In the event of a root or crown perforation, the prognosis is guarded and depends on the access to the perforation that permits surgical repair. So we need surgical repair in that case.